Hello and welcome everybody to Physician in-Service Training. My name is Erin and this is brought to you by Blackpoint Insurance. This is just one of a series of trainings that we're doing a few times a month just to help people really grow and retain their business. I own Blackpoint Insurance and we are a national general agency that helps Medicare beneficiaries learn about the A, B, C's, and D's of Medicare. And we also work with agent and brokers to help launch, grow, and build their businesses. So we're excited to be with you and to get started today. Today's focus is physician in-services. What's that? How does it work? And how can it help you grow your business? This is really a continuation from the last training we did, which I recommend you watch on video if you haven't seen it already, which is all about physician marketing and growing and building those relationships. Again, my name is Erin. You see my name here, and here's our local office phone number, as well as our local office email address. If you have any questions or need additional training or help or support, please let us know. Many of you are agents that work with us already, and as you know, I'm always here, vested to help you grow and build your business. If you're new to us and would like more information about working with us at Blackpoint Insurance, please don't hesitate to reach out. We'd really be glad you did to see if we can help you grow your business. For now, let's go ahead and get started. So I want to tell you a little bit about myself. My name is Erin, and I have been in the Medicare insurance business for almost 30 years, a long history, and I think I'm in a good position to help you learn how to grow and retain your business because I've had a lot of experience working in Medicare, okay? And so initially my career was selling, working as an agent for different various health plans, talking about different plans and products available. And I ended up working my way into management. And my last part of my career, I actually worked for Anthem Blue Cross for 8 years, running sales nationally for what they call all distribution channels. So field broker agents like yourselves, field sales representatives that were employed by the company, as well as telesales. So I've seen a lot in terms of how this business is marketed and how people grow it. And I was convinced when I launched my own agency about 5 years ago that we could do things a little differently. Our focus would be on educating Medicare beneficiaries on the A, B, C's, and D's of Medicare. And we would really bring in brokers on our team who shared a like-minded philosophy that just by helping people and doing the right thing, we would ultimately grow our business. And it's been wildly successful. We've grown significantly. Our team has really been able to build up a completely referral-based business. And we're helping agents and brokers to do the same so that you can benefit from that and having a book of business that you can retain for years to come. We provide training and support. We want to make sure that you not only have access to these trainings, but you have help building a strategy, getting your questions answered in real time. We're here to build that relationship with you. And it's not just one and done. It's a long-term relationship about growing your business in the way that works for you. If you're interested in growing based on referral, there's a number of ways to go about that. Being that person in the community, that's the Medicare person, or whatever your industry is, you can grow a referral-based business by growing long-term relationships. Our focus in the last couple of trainings has been all about provider and how to make that work for you in terms of growing your business. So for now, let's get started. Today's agenda is a full one. We're going to really make sure you walk out of here knowing how this works. For those of you who need follow-up help, please don't hesitate to reach out to me. But a physician in-service, what is that? How do you get started? How do you prepare your content? What do you talk about? What kind of topics could you cover? And then ultimately, how does that continue to foster and build that relationship to help you earn referrals and really grow to a point where you've got 100% referral-based business? Let's jump in and get started. So what is a physician in-service? What are the goals and outcomes? So as you're kind of out there at physician offices, you're meeting with them and connecting and growing and trying to build a relationship. You're building that rapport. You've seen that they've seen you based on repetition, going in there, adding value, answering questions, bringing your business cards, bringing goodies, all those types of things. And at a certain point, by your third or fourth visit, as you start to establish rapport and relationship, it might be time for the next step. And I call that next step a physician in-service. What is that? So essentially, it's just an educational meeting or training where you dive a little bit deeper on an important topic to that office. Maybe it's Medicare 101, the A, B, C's, and D's of Medicare. Maybe it's talking about specific plan types. Maybe it's a topic they bring up in research and you bring that information to them. Often they're done at a breakfast meeting if the office opens early. It can be a brown bag lunch and learn, but it's simply what you're there to do is to establish and grow that relationship and bring information that's relevant to that office. The reason that you're willing to do all of this, make these touch points and provide additional information of value is you want to be that trusted resource about everything to do with Medicare. So you're getting those referrals, the questions that come in, you're the source of truth. When they start to see the person in the scenarios that you present, they're going to say, hey, I need to talk to Erin about this. I need to get more information. I want to refer this person to my local Medicare representative to get more information. So it's really just an educational lunch and learn type meeting where you're going to dive deep on a number of different topics. What kinds of things are they interested in? I always suggest ask them, right? What are they interested in? What kind of issues are they seeing with Medicare beneficiaries? What's coming up for them? Are beneficiaries not understanding the referral process? Is there a way to explain how that happens in the pre-sales end and what you do to educate clients in terms of what they're enrolling in? Are they having trouble understanding the drug formulary or the prior authorization process? Do they just not understand the A, B, C's, and D's of Medicare or the difference between a Medicare supplement and Advantage plan? What's coming up for them where you can provide some value and information that they could have when they're seeing their patients? These are people that you've identified that are working with the people that you want to work with. So in any business, whether it's Medicare or something else, that's really the key, is establishing yourself as a source of truth and an expert with the people who are working with the people that you want as your ultimate customer. So being inclusive and asking for the topics that they want to have covered, that's key. Now, if they don't have anything that they can come up with, of course, the A, B, C's, and D's of Medicare can be a hot topic. Comparing what an Advantage is versus a Medicare supplement, talking about the gaps in Medicare and how those work can be really hot topics. Maybe you want to, in preparation for AEP, make a not for distribution little benefit grid of all the different Advantage plans. Explain to them what an Advantage plan is, how it works. What's this enrollment period all about? What is this an opportunity for beneficiaries to do, to add or change coverage if they're already on Medicare? Why would they want a Medicare Advantage plan, like a zero premium plan that works with their doctor with lots of bonus features? So you're bringing this information to them, because a lot of times when these doctor's offices are working with your clients, they may not understand the very real need to keep the costs down, to have prescription drug coverage included, to have bonus features as part of the plan. So by educating them and bringing them along, you also help to ensure a good experience for the clients you do bring on board. In terms of timing, what works for them and their schedule? Be respectful of their time. So you don't need hours and hours to go over this information. You want to be prepared and keep the information tight so that you can meet into their schedule. Maybe they have a team meeting once a month. Maybe they have brown bag lunch and learn. Maybe you can get in on a breakfast meeting, that type of thing. So coming in, providing value, and being memorable in a good way to give them more additional information. So I want to talk about some tips for success. You can see my wild dog here is ready. Preparation can only lead to success. And I really believe preparation is everything in terms of working with these partners, really laying it out, what you want to do, having those details documented, and then following up on what you said you were going to do. So be sure to calendar that activity. So you should have time slots on your calendar that are booked for physician in-services. So when you're in doing your rotation and talking to these doctor's offices, you're saying, hey, when can I get on the books? Here's my 2 dates of availability. Can I get in there on those dates? What works for you? Let me try to make that work with my schedule. So calendaring things really helps to ensure that they're going to happen. You can't just wing it. They're not going to let you in and do this kind of meeting, and you wouldn't want to. You want to be prepared and have the right materials set up to deliver good, effective information. You need to prepare leave behinds and goodies, right? So you can't just go in there and just talk. You need to have some documentation that backs up the information you want to present. Maybe it's the A, B, C's, and D's of Medicare. What are those all about? Have something prepared for them that you get from Medicare and You or Medicare.gov that you can leave as a leave behind. You're certainly not going to read that information, but you're going to talk them through those details and have documentation to support what you're reviewing. Of course, bring plenty of goodies. If it's a breakfast meeting, you can bring your bagels and cream cheese or your muffins or whatever it is, bring some fruit and be there to make it a fun experience for the team. The third thing I think you really want to do is write out your script. So once again, you can't just wing it, right? You need to think about what you want to say, the points you're trying to get across, and the touch points to give up. Be interactive. Can you ask a question to get them going down a path where you can be more descriptive? Can you connect the situation to the patients they're seeing? You know, are you coming across patients that don't really know how to work their drug formulary, that are confused, that are complaining because they're paying higher out-of-pocket costs, those types of things? And you need to practice. So again, you want to make sure that you've gone through the information, decide what you want to talk about, and then practice those details. Make sure you're comfortable with the information, you're comfortable with the types of questions that can be asked. And it can be helpful to get a partner. I'm like a big proponent of practicing in front of the mirror and understanding what I'm going to be able to do, but practice with a partner, a friend that is going through the same and can bounce ideas off of you and make sure that you're ready. Another key is to dress for success. So it doesn't have to be formal wear, but always professional, whether you're a business casual style or business style. You want to dress for success and be polished for the part. If they're going to be referring people to you, they need to like you, they need to feel comfortable that you're professional. So make sure that you're ready when you're going into these various offices. It's important as you prepare materials for provider offices, it can be quite liberal in terms of what you share with them and what you create, but you want to be careful that all of your materials have a do not distribute sign on them. So you can't just have them making copies of things that you create and distributing it to potential clients. They need to make sure they know not to distribute any materials unless it's approved compliant materials like a summary of benefits or that type of thing. You want to be on time. So it seems like it goes without saying, you know, if you say you're going to do a noon lunch and learn meeting, you want to be there at least by 11:45. You want to set up, have snacks set out, that type of thing, materials distributed so that you can be respectful of their time. A lot of times at the doctor's offices, they're doing it on their own time, their lunch hour, that type of thing. They're wanting to meet with you and get this great information. So you want to be timely and you want to make good, efficient use of the time that they're putting forth. Know your audience. And I mean, really know your audience. By the time you're asking for an in-service, you've been to that doctor's office at least 3 or 4 times. You've established a rapport and relationship. Hopefully you're starting to get referrals. You should know your audience, the people who are going to be there, their names. If there's new people, new faces that are coming for this, get to know your audience, be friends, right? Because these are people that are going to be building a relationship with you, and them liking you and really respecting the information you have to provide is going to help you grow and build referrals. And then finally, have fun. It should be fun. You want to be prepared out there and have a good time, but this is you generating leads for your business so that you can go to 100% referral based. So I really want to encourage everyone to look at these tips for success and get going on physician in-service marketing. Now, I want to remind you, if you're on the call, you can ask a question through the chat. We are recording, and if I see questions pop up, I'll try to address them as we go. But for now, it doesn't look like we have anything, so let's keep on rolling. So I wanted to give you a couple of case studies, preparing your content. What could you specifically go over or offer as you're trying to get these offices to ask for a physician in-service? Now, you want to tailor the information that you provide specifically to your audience, right? So a Medicare 101 that you might give to clients may contain some of the core information that you would still give a provider's office, but keep in mind what's important to them, what their interactions are with their patients in order to provide the right level of detail. One of the most effective Medicare 101s for providers' offices just involves going over the A, B, C's, and D's. What are the parts? What do they cost? What do they cover? Just in general. Why do people need additional coverage? Isn't A, B, C, and D enough? What are these additional plan types? What is a Medicare Advantage plan? How do they work? What's an HMO Advantage plan versus a PPO? How do those work? On a Freedom of Choice Medicare supplement, how do Medicare beneficiaries access their benefits? Why would anybody choose that at a higher price point over one of the Advantage plans? When they go with the Medicare supplement, How do they pair it with a Part D? How does that work? If they're with an Advantage plan, is the Part D embedded? And how does that work? So just understanding the situations that their patients might be in and helping them gain a greater understanding. I don't know about you, but there's all these times that patients will call the doctor's office and say, look, I'm working with an insurance broker. I want to know if you take XYZ company. And sometimes that puts the office into great confusion. What do you mean? Is it a commercial plan? Is it a Medicare supplement plan? What kind of coverage is available? I'm going to take a second here and just make sure that we're on mute. Let's see. All right, looking good. So at any rate, on Medicare Advantage plans, you really want to be able to understand, why would a Medicare beneficiary want that? A lot of times the doctor's offices just can't understand, why would a Medicare beneficiary want to go on an Advantage plan? Why would they want to sign their Medicare over to an insurance company? Sometimes you can make it really real for them, talking about how for low or no cost, they can access their care. It includes prescription drug coverage and a lot of bonus features that Medicare doesn't cover, like glasses and sometimes dental and hearing and more. And this can be very valuable to Medicare beneficiaries. So making it relevant and just demonstrating that you're the trusted resource, demonstrating that you're putting in the extra effort to make sure that the Medicare beneficiary is getting the real deal in terms of how these plans work and how they'll be able to use it, because you're making yourself more trustworthy and you're really making yourself someone that they would want to refer to, as well as educating them along the way on how this works. So it's really important that you walk away out of these meetings being that trusted resource. You're the Medicare person, you're the expert, and it can apply to any business that you're having and any business that you're trying to build relationships, right? So you found your target market. You know for Medicare that physician doctor offices are a great source of referrals. So you're building that rapport and relationship. From there, you want to leverage that relationship you built to become an educator, a trainer, a source of truth, a resource. And you literally could apply that to any industry where you're looking to grow a referral-based business. So it's really, really important that you be smart about that and you use this as a real opportunity to create that dynamic of your expertise so that you're getting more referrals. So case study number 2, Medicare Advantage Part C. So we're in a unique time right now because we're approaching the annual election period, that period between October 15th and December 7th, where people who are already on Medicare have the opportunity to add or change Advantage plans or add or change drug coverage every single year for a January 1st effective date. All of you know that. I'm preaching to the choir on that. But the doctor's offices don't necessarily understand the election periods. It doesn't have to be AEP. It could be OEP. It could be special election periods. These are areas that the provider offices are unlikely to understand. And again, you can be that source of truth, that educator to help bring them along. It also puts you top of mind when patients need someone neutral, a broker that works with all the different plans to talk through those different options. It's really important for, I believe, the doctor's offices to understand this enrollment period, that they may be getting more and more questions from beneficiaries that are getting marketing, advertising, calls from existing plans. What does that mean? And how can you pitch in as a trusted resource for all the different potential plan options? Why are beneficiaries enrolling in the Advantage plans? We touched on this before. What makes the plans valuable? Why would somebody want to assign their Medicare over to an Advantage plan? What are the things they're picking up in terms of additional value? Why you as a broker? So explaining how brokers work. Basically, the beneficiary can call all these different health plans and get information, or they can work through you that works with a variety of health plans and helps meets their need with the best possible plan option. So creating yourself as a source of truth across all plans so that doctor's office is likely to refer to you versus anybody else who's asking for referrals. So you're the person who's that trusted resource, no cost to the Medicare beneficiary to work with you. It's all built in with the insurance companies. So really explaining what a broker is, what we do, and how that can be beneficial to their patients. You can go through benefit highlights, but this is where you want to be careful. I recommend when you do a physician in service that you're creating a little grid, things like plan name, star rating, premium, office visit copay, specialist copay, hospital copay, any other hot highlights that you think are important to exhibit. And then also the bonus features, things like vision and transportation and hearing and fitness and over the counter. As you know, Advantage plans are a plethora of all these valuable added benefits. And so putting those on there so that they can see that at a glance, be sure that you have your disclaimer, don't make copies, not for distribution. It's just for education of those offices. And you'll be amazed as you're educating them on these plans, they're starting to see some of their patients in these plans. Like, wow, this would really benefit even my mom or my relative or a patient that I've seen. They're struggling with the cost. They're struggling with their prescription needs. I can't imagine that this plan can give them additional value. Gosh, I know a patient that is struggling because they have no rides to doctor's appointments. Imagine a plan that included transportation. So you can start giving some of these examples, and they're going to start connecting it in their head of people that they know that could actually benefit from the highlights you're reviewing. So it's really, really important that you make it real. You don't want to go in there with a ton of plan information and be reading benefit information. Scenarios, examples, that's how you want to describe this so that you are really putting them in the shoes of seeing a beneficiary that might have value from the benefits that you're offering. That's the connection you want to make there. You want to address common concerns and questions. Gosh, are Medicare beneficiaries not understanding the lock-in provision? They're not understanding that they need to get referrals. Explain how you explain this to make sure people are fully aware of the type of program they're getting into. Offer yourself as a resource that can help people through this, to help them through the decision tree, that make sure they're making the right plan choice for their situation. So again, just building upon the trusted resource. Medicare Advantage plans are great. This is the open enrollment, but it might not be for everyone, right? And so just explaining that you cover all the bases to make sure you're matching up people with the best possible plan coverage to meet their needs and wants. So really making sure that they know your expertise. So all of this is about building the relationship. So, you know, again, it's never one and done. It is the long game all day long, right? So getting into these doctors' offices, becoming friends, going in there, building the relationship. It starts in slow. You're always asking, what can I do for you? What can I bring to you? And eventually that's going to translate into referrals, you being that trusted source of truth. That's the most important thing, is that you're credible and you're bringing good information, and they're going to know that you're consistently there. You're not just coming in because you wanted referrals one day and you never come back. You're coming in on a regular basis and building that rapport and relationship with them. Always expressing gratitude. Seems like it goes without saying, you know, thank you for having me in so that I could give you this in-service presentation. Thank you for the referrals that you're bringing. Thank you for using me as a trusted resource for your patients. I know that they're important to you. They're important to me too. We have like values and we're connected on that. Always asking for the next step. So sometimes the next step is another physician in service. What topics do you want next time? What would the staff benefit for additional training? Is there a carrier partner that you want me to bring in on a specific topic? Do you want to learn about ancillary add-on benefits? What would be helpful to that office? And they're going to give you this information if you're listening, right? So listen up and gather additional info so that you know what's going to make sense for them for the long haul. If they ask a question and you don't know the answer, totally okay, but make sure that you follow up. Get that information for them. Be sure to call, send a note, get contact information, and always keep your word. If you say you're going to do something, make sure you follow up and do that, because that's your credibility and that's going to make you that trusted resource. The next step in building this relationship often can be profiling doctors and taking it to the next level. So again, just with the theme of like AEP, this period is coming. We're going to have a lot of patients that are coming to see, or clients that are coming to see us that need a new doctor. Are you taking patients? Can we feature you? Can I get your photo? Can I get more information or publish the information I've already gathered about your office hours and languages spoken and that you're taking new patients? Do you want to come and speak at my seminar? Do you want to join my webinar and talk about how, you know, you like working with me and the different plans that I offer? Those types of things. So you can really take this to the next level to help build and grow your business once you've earned that respect and you've become that trusted resource. So at this point, I've covered what I wanted to cover for today. I hope this was good and valuable information to you. I don't see any questions in the chat. I'm just looking here, but if anybody has any, this is a good time to ask it. I want to make sure to point you to the direction of our website. You can always visit us at blackpointinsurance.com. Also, if you would like to set up an appointment to work with me or you need help strategizing for your market, please call the office and book an appointment with me, or you can email us at reservations@blackpointinsurance.com. At this point, I just want to thank everyone for joining me today. I hope you found this valuable. If you have any questions at all, please let me know. We will be publishing this on our YouTube channel, and we'll make sure that you get that so you can watch as many times and enjoy as many times as you want. If you have any questions, as always, please don't hesitate to reach out to me, Erin at blackpointinsurance.com. Thanks, everybody. Have a wonderful day. Thank you for your time.